the big story. We'll talk about that.
Namaste and greetings. I, Naina Agarwal, researcher at IMPRI, Impact and Policy Research Institute, Prabhav Evam Niti, Anusandhan Sansthan, Nai Delhi, extend my warmest welcome to you all to IMPRI Web Policy Talk. We are gathered today for a panel discussion on population, health, and Union Budget 2023-24. This discussion is organized by the Center for Human Dignity and Development, CHDD, as a part of IMPRI Web Policy Talk series. The State of Population and Development, #Population and Development. This discussion is a part of IMPRI's third annual series of thematic deliberation and analysis of Union Budget financial year 2023-24 being organized from February 2nd to 7, 2023. I welcome all of you to this enlightening deliberation and thank you for tuning into this discussion. Our chair and moderator for today's discussion and our series is Dr. Devender Singh, Global Studies Program, University of Freiburg, Germany, and Visiting Senior Fellow, IMPRI. We welcome you, sir. The panelists for today's discussion are Ms. Urvashi Prasad, Director, Development Monitoring and Evaluation Office, NITI Aayog. Welcome you, ma'am. Professor Sanghmitra Sheel Acharya, Professor, Center of Social Medicine and Community Health, Jawaharlal Nehru University, New Delhi. Welcome you, ma'am. Professor Pradeep K. Panda, Professor and Dean, School of Public Health, Asian Institute of Public Health University, Bhubaneswar. Welcome you, sir. Professor Praveen Jha, Professor, Center for Economic Studies and Planning, School of Social Science, Jawaharlal Nehru University, New Delhi. Welcome you, sir. Mr. Abhijit Mukhopadhyay, Senior Fellow, ORF. Welcome you, sir. Now, without any further ado, let us start the program. It is my honor to invite Dr. Devender Singh to start the program. Over to you, sir.
Thank you very much. I will share my screen. This just to give a little context, what I'm hoping that we will be able to complete in this panel discussion. So why we need to discuss this? First of all, budget is no more just a simple statement of revenues, expenditure, and allocations for the coming year. It has become over the years a window on the thinking of the government, kind of a vision document about national priorities and policy regimes. And we all know that health is very important for the individual as well as the society and the country, especially in the context of India having large population in the productive and reproductive age groups. But at the same time, when we are talking of demographic dividend, there is a looming aging issue in the country. The population age structure shift is very noticeable. So what I'm proposing that the budget for population health should be guided by demographic epidemiological intelligence and emergent needs. And we are going to discuss whether that is the issue here or not. So in the panel discussion, what am I expecting from the esteemed panelists to focus on? We will start with their overall impressions like what is the population situation, what are the health needs, what are the priorities, and whether they have been taken into account while formulating the budget proposals. And in this context, we can also reflect back on what was allocated or prioritized in the last year's budget, and what has been the actual expenditure on different programs. So, and from the budget, what we can deduce, like what are the emerging priorities in the population and health from 23 budget, and also like if there is what is good in the budget, what is bad in the budget, and also like is there something which you would have liked to see in the budget. So these are three broad areas where we can focus our presentation, this opening statement, as well as later on when we come back again to discuss certain issues. So what is demographic intelligence, why, and population health, what is the relationship, why it should be important, and what is my initial kind of impression that budget does not seem to acknowledge or respond to the population age structure, or the location, population location, are the issues emerging out of the shifting population age structure. There is hardly any focus on young girls and boys. There is no additional allocation for schemes for older people. The issues which emerge from the National Family Health Survey and other health surveys, like maternal health, nutrition, overall shift, epidemiological shift from communicable disease to non-communicable disease, where they are accounting for almost 2/3 of the disease burden as well as deaths. So that does not seem to be taking place. What we had envisaged in 2017 National Health Policy, which is a government document of this government, that we will be attempting to reach expenditure on the health sector of up to 2.5% of the GDP by 2025. So the current budget shows that we are lagging behind in this in that aspect also. So overall, what my impression from this budget is the demographic intelligence is missing and population health remains at the margin. Now it will be over to esteemed panelists. First, I'll invite Professor Jha to give overall impression and what is good, what is bad, and what are key takeaways from the from this budget. Professor Jha.
Thank you, Professor Singh, and thank you, the co-hosts, for including me in this conversation. It is always a pleasure to be part of your conversations. Now, as regards some of the key questions that Professor Singh has flagged and has already given some leads in thinking about these, I would consider myself largely on the same page, and let me just elaborate a few things. If there are two very, very key messages which have been given by this budget for 23 to 24, essentially, the first big ticket message is that invest in something called infrastructure, CapEx, capital expenditure on infrastructure. And by and large, this means really big ticket items, roads, railways, ports, and so on. And everything, all problems of India will be taken care of. You know, so this is, if you want the biggest takeaway, that seems to be the story, right? Connected with that, essentially, what do we see? When it comes to the gross expenditure, right? The revised estimate for the last fiscal was approximately 42 lakh crores, right? Allocation estimate for the current fiscal, you know, from April to March, 23-24, what is it? Essentially 45 lakh crores. Do a very simple arithmetic. Both these are nominal terms. Account for inflation, what happens? In real terms, it shrinks. Compared to the last year's expenditure, in real terms, accounting for inflation, it simply shrinks, which would mean what? Aggregate expenditure is going down. Now, there may be one or two sectors here and there which will be given some positive attention, which is exactly what we see in this budget. So if you look at, the major sort of aspects, programs, and so on, things which impact very directly on the well-being of people. Let me take, for instance, education and health. So National Education Mission, National Health Mission. So last year's allocation for National Health Mission was 37,160 crores. This year's is 36,785 crores. Even in nominal terms, it has gone down. Real terms, of course, the fall would be sharper. National Education Mission, last year's estimate, BE, it was 39,553 crores. This year's, we are looking at 38,953 crores, right? And these are, by official definition, are the so-called core schemes of government. There is a category called, so core is, the way in official jargon it is defined, Mahatvapurn scheme. And the first 6, it is Ati Mahatvapurn scheme. Right? And in those, in case of 5, you find that in real terms, it has gone down. 5 out of 6, Ati Mahatvapurn scheme, right? So whether it is Mahatma Gandhi Rural Employment, National Social Assistance Program, Umbrella Program for Development of Minorities, and so on. So essentially, what the government acknowledges as the most important schemes, they have been squeezed, but for 1. Out of 6, 5 have been squeezed in real terms. Similarly, when you're looking at core schemes, the second category, in most of these, you find that there is a squeeze in real terms. Of course, as I mentioned earlier, there are a couple of things where you find there's some upscaling. In fact, in case of Pradhan Mantri Awas Yojana, there is a very significant upscaling compared to what the budget allocated was in the last year. Although the revised estimate was much higher. Likewise, Jal Jeevan Mission and so on and so forth. So, barring 2 or 3, what the government acknowledges as very, very important, very critical, you find that there is no attempt to do anything about these in terms of upscaling these, taking care of these. So either one may assume that all achievements which were hoped to be achieved are already there. So there is no reason to put additional money there. Now, we know that in each of these sectors, rural economy, health, education, etc., it's almost a crisis-like situation. Professor Amartya Sen repeatedly makes this remark that India is, among the significant countries, India is possibly the only country which hopes to become a superpower by neglecting health and education. Now, obviously, it's something which is extremely worrisome, right? Of course, once we start getting into subcategories, different heads here and there, and so on and so forth, and there is huge connectivity between them. So what you do to MDM has huge implications for health. What we do for ICDS has huge implications for health. Look at these, what has happened to, all these schemes that I'm mentioning, again a squeeze, right? Where are we headed? Professor Singh was talking about demographic intelligence in the context of so-called, much talked about demographic dividend. I think we possibly have not used that dividend in any substantive fashion. possibly we have actually turned into a demographic disaster. If you look at numbers pertaining to educated unemployed, right? We are talking of, more than 25%, 30%, 30% plus and so on across different states and etc. So that's the kind of overall situation. What does this tell us then after these two key messages? So you want to focus only on infrastructure, capital expenses, the expenditures there, and hope that everything will be absolutely fine. Yeah, and essentially the implicit message there is that try and take care of growth somehow. It doesn't matter where this growth is, which sector this growth is, right? But as long as you have a reasonable growth rate, and then you keep talking about how IMF has said that India is bailing out the world, how World Bank has said that India is bailing out the world, world and so on, because India is the lone bright spot and so on in terms of growth rate, right? 6.1% IMF estimate and so on. So between 5.5 to about 8, different think tanks are giving you all these estimates. Doesn't matter what the structure of growth is. Doesn't matter what is the structure of that capital expenditure. Is it going to health sector? Is it going to MSMEs? It is going to all these extremely important sectors and segments, which will then give us the true demographic dividend that Professor Singh was alluding to. Now, as far as I can see it, it seems like a very, very worrisome landscape. Right? So let me, I think, as my first remarks, let me stop there. And if there are further clarifications, I'll come in. Thank you, Professor Singh.
Thank you very much, Professor Jha. Now I'll invite Professor Panda. Last year also you bagged many issues which were good in the budget and which you would have liked that they could have been there. And this budget is coming not very far from the pandemic situation, the great pandemic which we witnessed. And we were talking about how the health system has been strengthened, our research, or even epidemiological intelligence, what could have been done at that time. So taking that discussion and your overall impression for the budget this year, I invite you to share your views, please.
Thank you so much, Devender ji, and I'm most grateful to the organizers for this opportunity. In a world of uncertainties, the central government was committed to fiscal consolidation, which required deficit reduction, as you know. The overall budget deficit is estimated to be reduced to 5.9% of GDP, gross domestic product, in financial year 24, from 6.4% of GDP in financial year 23. Under such a difficult situation, the central government quite wisely decided to reduce revenue expenditure and reallocated the amount for capital expenditure to support and boost growth. This is most welcome. However, the allocation for the health sector, both revenue and capital, was a bit disappointing. Even though the allocation rose by 12.6% in financial year 24 over financial year 23, its share in the gross domestic product or GDP remained quite low at 0.3%, both in financial year 23 and financial year 24. Within this lower allocation, the government reallocated funds across different schemes or line expenditures. The announcement for setting up 157 new nursing colleges, a mission to eliminate sickle cell anemia by 2047, the collaboration between ICMR and public and private medical facilities for using ICMR laboratory for research and innovation, skilling manpower for manufacturing of medical technology are most welcome. So there are some other non-health sector announcements that may also benefit the health sector. I'll speak few of them. Atmanirbhar Clean Plant Program to improve the availability of disease-free quality planting material for high-value horticultural crops, and emphasis on millets, Sri Anna, what the finance minister said, will contribute to lowering the lifestyle disease burden. The establishment of Center of Excellence for Artificial Intelligence will accelerate India's digitization focus. The 100 labs that will be set up for developing apps using 5G services across sectors, including the healthcare sector, will accelerate access to care. The national data governance policy can truly be a game changer, specifically the use of healthcare data, enhancing overall privacy along with National Digital Health Mission. Now, if we look at the budget, there has been considerable increase in budget allocation in some of the schemes and projects. And in some other case, either it has declined or it has remained the same. So I will highlight few of them where there has been considerable increase in budget allocation. So if we compare the revised budget estimates for financial year 2022-23 and budget estimates for financial year 2023-24, we find these key findings with considerable increase in budget allocation. 146% increase for National Digital Health Mission, NDHM, from 140 crore to 341 crore. Second, 130% increase for Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, PMABHIM, from 281 crores to 645 crores. 59% increase for flexible pool for RCH and health system strengthening, National Health Program and NUHM, National Urban Health Mission, from 13,854 crore to 22,094 crores. 41% increase for National AIDS and STD Control Program, from 2,182 crore to 3,079 crore. However, the flagship program of the government, one of the flagship programs, that is Pradhan Mantri Jan Arogya Yojana, PMJ, there has been only 12% increase in nominal term, from 6,412 crore to 7,200 crore. So now, what is missing in the budget, as Devender ji was saying and Professor Jha also talked about. Now, this PMJ, Prime Minister Jan Arogya Yojana scheme, was not being expanded to include the missing middle. There was a very nice report prepared by NITI Aayog last year. So they found that there was a 40% missing middle who do not have any health insurance, but they are paying their health expenses out of pocket. So how to include them? In this budget proposal, there should have been some way to expand the coverage of the missing middle, and that has not happened. People who are outside any health insurance coverage. So there should have been attempt to bring them under financial risk protection. That has not happened. Second, there was no major push towards strengthening the healthcare infrastructure, specifically primary healthcare infrastructure. So in order to achieve universal health coverage, public health spending needs to be ramped up. It should be at least 2.5% of GDP. It is mentioned in the National Health Policy of the government of 2017, and it is reiterated by recent economic survey as well as Finance Commission. So now the issue of non-communicable diseases. We know that the prevalence of non-communicable diseases is increasing quite dramatically. So if you look at Delhi, disability adjusted life years as a measure of disease burden, and 55% of the total disease burden in terms of DALI is due to non-communicable diseases, diabetes, hypertension, cardiovascular diseases, and so on, cancer, and so on. And if you include injury and accident, another 7%. So more than 60% of the disease burden is due to various NCD, non-communicable diseases, as well as injury and accident. But where is the allocation for the non-communicable diseases? That has not happened much. So which is evidence-based policy making. So data should have been taken into account. Another thing is that under the tertiary care program of the center, all major non-communicable diseases are covered. And central government provides money for treatment and so on. The central government transfers money to the states for the implementation of schemes like cancer, diabetes, cardiovascular diseases, healthcare for elderly, mental health, etc. In this budget, there has been a reduction to 289 crore from 500 crore last year. Another issue is actually GST rationalization in healthcare. So many people in the industry, they are demanding, that has not happened. So I'll stop here. Thank you.
Thank you very much, Professor Panda. Now over to Professor Acharya. Overall impression in the context of what I had put, but you can add, like in terms of health research, there are some proposals, but whether they are more lab research, lab-based research, which is being promoted there, or more private sector kind of focus, and not so much on like public health research. So, and how the overall strengthening, they're saying we will open 57 new nursing colleges. So, so how the health cadre, like the initiatives have been taken, and whether you are okay with, are happy with the initiatives which have been taken, or there could have been moved in the same direction, and overall impression, like it's open field. What do you think?
Okay, thank you so much, Professor Devender, and thank you, IMPRI, for bringing me on board this discussion. I'm sure this is something very important we need to talk about, particularly in light of what we've recently experienced in the form of COVID, and the way our health system, if I may say, has kind of crumbled. Although there have been efforts made throughout the pandemic, even after pandemic, to kind of reflect, well, we did try to make our best of efforts. But then if we really look at how things have shaped up, I would really want to bring our notice towards the very absolute figures which have been actually talked about in terms of the budgetary allocation. Now, if we look at the absolute numbers, and my colleague has already talked about in terms of the absolute overall total allocations, I want to draw our attention towards the budget estimates, which are largely for the healthcare. If you look at the 22-23 budgetary allocation, it kind of rested at 86,200 crores, which seemingly has kind of improved if you look at the current budgetary allocation for the health sector to 89. So 89,155 crores to be precise. But then if you really look at in terms of the proportion of the budgetary allocation for the healthcare spending, it seems to really have gone down from 2.2% that it was last year to about 1.97%. Now, this in the backdrop of all that we've been promised, we might want to look at how much of those promises have gotten on board. Also because to my mind, health is something which needs to be seen in terms of perhaps locating it in its social imagery, locating it in its nuance of the social reality. And by that, what I'm simply trying to say, when we are designing healthcare systems, we know that it is not easy to do that, because if I can borrow from what Arrow said way back in 1963, that when we are looking at health care systems, the elements which become functional to organize it are really governed by three important factors. The uncertainty of the demand that could be created, and we've seen that very much during COVID. How is the information asymmetry which exists in terms of the dissemination of information regarding various systems wherein the care can be provided? And the third very important element could be pegged at the hyperbolic tendencies which we experience. And therefore, when the budgetary cognizance has to be there for health, I think it becomes very, very important to get on board, to be very mindful of all of this. And I say this precisely for the reason that the promises perhaps which were made last year, how much do we see have we progressed from? Especially if I probably want to peg on what came to us in the form of Make in India, what came to us in the form of startups that were put in place, what came to us in terms of digital India. And that's where perhaps a lot of pegging has happened. If I may kind of bring in, remind ourselves perhaps the very digital divide that exists between, let's say, India and Bharat for very much. And even within India and within Bharat's, I would say digital divide exists across gender, across social groups. Now, therefore, when we talk in terms of, digitalization of, let's say, PMJY, for example, my question would still be that how much of HMIS data has become useful for us? And that is where I'm trying to draw the connect vis-a-vis the allocations that come in the form of research and research-related activities. Although we get to see that there have been certain allocations in terms of what research collaborations, if I may say, can happen through the ICMR labs. And also through the research institutions, both in the public and the private sector, and even industry in the public and the private sector. As we know how public-private partnerships work, research mandates would become very, very important and very, very consciously drafted in terms of how do we peg it. A lot of thrust has been already reported, or at least the budget gives us a sense of, on the pharmaceutical research. Fairly much we need that, I'm sure, especially in the light of preventive medicine. We do have a pharmaceutical industry playing a very important role, vaccines, for example. But then the outline for ensuring how these partnerships will evolve, how these divides in terms of, getting into this collaborative research really doesn't seem to be. Perhaps we have to wait for the outline guidelines for something of this. And I say this very consciously because when I read about 157 nursing colleges to be put in place vis-a-vis the existing 157 nursing schools and colleges, to me, I am still struggling to figure out whether this is 157 plus 157, or is it renovation, accreditation, upgradation of the existing 157? I'm not too sure if I've comprehended it. Nevertheless, what's important is that the cadre for public health machinery is going to get built in. In this light, perhaps we also therefore need to think about what is happening to the existing cadre which is there. What are the training elements which have already gone in through the last budgetary sessions? How have we progressed from there? I really do not seem to be having much to be able to analyze that bit. And I take the onus on me. Perhaps I've not given that due kind of time to be able to do that. But then I did try. I still do not have an answer for that. But there are a couple of things which I think give us something which we need to think about in terms of, again, research that you've kind of pegged me to think about. When we talk about the budget, this year's budget, something very interesting has been listed over there towards elimination of sickle cell anemia, which is a disease which strikes a good share of a tribal population. And I think this is one positive which I pick up from this year's budget, because when we are saying inclusive development, when we are saying, provisioning of health to, to the last person, I think this is one very, very particular step that we need to take on board and perhaps see how well it will become functional, what will be the mechanisms to make it functional for that matter. The other thing I thought this budget is also alluring us towards research is when, when we've talked about in the budget in terms of telemedication vis-a-vis mental health. I think that's something very positive, because if we connect mental health issues in terms of stigmatization, in terms of how we do not open up about the mental health issues, to my mind, perhaps telemedication will give that edge over in terms of getting connected access vis-a-vis the care providing institution. However, the question regarding digital divide will always be there. So, like I said, what will be the roadmap to be able to do this is something perhaps have to wait and kind of see. A lot of pegging has happened in similarly on other programs such as the Mission Shakti, Mission Vatsalya, Saksham, Anganwadi, for example, Poshan 2.0. But then what has gone in the backdrop of these programs needs a lot, perhaps, to see what will happen through these programs. We haven't really gotten much from the ones which have already been in function, if I may so within quotes. That was one thing. The other thing perhaps I would want to bring in over here, Dr. Panda has already alluded to it. If we're talking about these mechanisms through the budgetary allocations, the non-communicable diseases we know have been increasing fairly much. If you go by what has happened between the 1990s and let's say 2016, I mean, the very health portal of government, of course, through the NFHS data, tells us that there has been almost an increase, doubling of the increase from, let's say, 37% odd to about 61% of all deaths are being attributed to the NCDs. Now, therefore, it becomes very, very important to make sure that the mechanisms for preventing communicable diseases vis-a-vis how we focus on certain things such as WASH, for instance, water and sanitation programs, hygiene, etc., becomes relevant. And now that perhaps connects me to the Swachh Bharat Abhiyan. Now, as much as I have been able to read about it, I think the connect which needs to be drawn with the health conditions has taken a backseat vis-a-vis the connect which has been perhaps there in terms of informing people about the program through various media sources. So that connect, I hope that this budget will kind of put in place. And I think we can bring the Jal Abhiyan also, Har Ghar Jal Abhiyan also can probably seen in the same light. So the point, therefore, I think I'm making is while there are allocations already being pegged in, something which really needs to be, perhaps we need to wait and see about is how will this be translated, particularly if we think research is becoming an important element to be able to reach, we are expected to reach vis-a-vis the healthcare. Therefore, the connect that I might want to see in terms of the institutions of higher education, particularly in the realm of medical education for that matter. The allocations for education, it says very clearly, the budget says in terms with the center of excellence, the determining factors or criteria that will be set up or that have already been set up for Center for Excellence, perhaps need to be taken on board in a particular way, wherein the cutting edge research could be formulated, executed without the trauma of administrative realms. How best that is going to happen, I'm sure we all have to wait and see how will these labs that are said, ICMR labs, which will become accessible for this kind of research, without the protocols, without the red tapeism, perhaps will become something which will be very, very important in terms of its execution. Something which perhaps I would want to see, I would have wished that the budget talked about in a slightly different way, is while we are talking about a lot of tertiary tertiary level care, I think we still really have not been able to get down to the grassroots level care, which had become, in fact, the turmoil at that level has already become very, very evident through the pandemic that we've already experienced. So while we are pegging on the tertiary level care, we still have not really, it doesn't talk about, what is it that we need to bring on board in terms of the access to the primary level care, people's access to the primary level care, and therefore I think the grassroots level workers also becomes very, very important in terms of, putting them on board, how we get there. I think I'll stop here and get back to some other issues later, if that works. Over to you, Dr. Devendra.
Thank you very much, Professor Acharya. Now I'll invite Abhijit. And Abhijit, if you could also, if you have looked at the data on the out-of-pocket expenditure, that's a major concern in India. Like 60% of the expenditure on health is out-of-pocket expenditure. So from the economic perspective and the head, like what the budget is saying, whether it will lead to its decrease or government is going to face the same burden in the coming years. Also, how the different proposals which have been, like, I don't know whether I'm right or not, but there is a lot of push for private sector in this budget, even in infrastructure development. What Professor Acharya was saying, the labs also, the center of excellence also. What I could see, they are also kind of being promoted in the private sector. So, your views, overall views, and if you have also looked at the out-of-pocket expenditure, then just if you can throw light on that also.
Yeah, just before I joined here, I was actually looking at the out of pocket expenditures. I just have the figure because I looked at the World Bank. Basically they are giving all those WHO health figures, but it is for 2019. It is you are right, almost. It was 54.78%. It is like 55% in 2019. It decreased. At one point of time it was more. It decreased after certain amount of allocation. In different budgets over the years. But definitely. But I'll come to that. I'll come to that. But here, in fact, let me start with whatever like all. You yourself, the chair, the respected panelists and dear friends, those who have joined the discussion, I can see at least 10, 12 people joining. So, it's a very good evening to all of you. And I'm very grateful to IMPRI for the invite. And, as a bit of an outsider in health, basically, I am gathering and I hope to gather new insights from today's discussion. Already I have got quite a few from Professor Panda and Professor Sanghmitra also. So, but I'll directly come to the brief points that I wish to make on the topic. Essentially, there will be some overlaps, of course, but then for me, when the COVID-19 pandemic hit the entire world, the acute lack of health infrastructure was evident in most of the countries. And India, of course, was no different. Now, lack of hospital beds, adequate doctors, health workers, lack of other facilities like, ICU, oxygen, testing, medicines, etc. All these things made people running from pillar to post in the developed urban areas itself. So, like a lot of people, many people were talking about all these also. Basically, they were talking about the lack of, health infrastructure. Probably, it's a good thing that pandemic happened. The flip side of it is that now people will start talking about it and something will be done. So that was the idea, with a very long-term vision to correct all these anomalies. And initially there have been discussions, to be fair, and talks on these lines, both at the government and I think at the non-government, civil society, other levels also. But as time passed by, particularly after that, severe, deadly 2021 Delta wave, now it's almost, close to 2 years. Now it is business as usual once again. But then, then what kind of infrastructure? Then I started looking at the, what kind of infrastructure we had. We actually have right now, whatever, with as much respectable sources, from as much respectable sources as possible. Number of hospital beds per 1,000 people in 2017, WHO data once again, 0.5. India has 8.6 number of doctors for every 10,000 population. So, that last year, I think Minister of State in Lok Sabha reported that India's doctor population ratio is 1:854. I'm putting it as 860 also. But then, it is definitely better than WHO standard of 1:1000. So that was the position they have taken. So now there is a catch in that also, because this reported number in Parliament, my own hunch is that, I am no expert, but my own hunch is that these actually include Ayush doctors. But the question is that, do they count as qualified doctors? Because I don't think so. But there are experts here. So I will put the issue, on the table here. Practically, and these are the problems which are happening, because practically there is no live registry of practicing doctors. So that I have found in different, because my core area is not health, but off and on, sometimes I work in some projects related to health. So I found out that, there is actually no live registry of practicing doctors. And a 2021 WHO report actually states that India was way below the 44.5 is to 10,000 ratio till 2018, and was just above the 2006 standard of 22.8 healthcare workers per 10,000 population. So, all these actually pointing towards the fact that ultimately all these Ayush doctors, I don't know, I hope it is not, but then probably, some of these quacks are also even counted or not. I really don't understand. But this is a very serious problem. Now, a 2021 study by the Indian Institute of Public Health, it found that the density of active health workforce in India is just a little over 1/4 of the WHO recommended threshold of 44.5 skilled health workers per 10,000 population. But, which actually, probably I'm repeating this also, but then they found that the shortage of midwives and nurses is much more severe. That is why probably I believe, as Professor Sanghmitra pointed out also, with the assumption that, there will be 157 brand new, fresh new nursing colleges, I think it is one of the few noteworthy measures in this budget. I think this is, apart from that, the entire, the tribal population targeted, that thing, or those are a few, noteworthy things that actually happened in this budget. But, coming back to once again the health infrastructure, the shortfall in primary health centers, the PHCs basically, as per median population, as on 1st of July 2021 in Indian urban areas, it stood at the all India average, was at 44.2%. And this is actually Ministry of Health and Family Welfare data. I am not putting, this is absolutely from the ministry data, government data. And of course, this shortfall actually varies widely across the states. Some states actually did very badly. And the noteworthy point here is that ultimately, even I was a little bit surprised that Kerala also has a very, high percentage of shortfall as far as primary health centers are concerned, when I looked at that table. So overall, so if you also look at the the HDI indicator, last when I checked, 2021, 22, it was 132nd. So it's not a very happy kind of a situation. So the point is that point I'm trying to make is that the entire expectation, entire, I would say, hope, post-pandemic, at the end of 2021, those who actually survived, those who didn't die, then the kind of hope they were having, some of those, the people with the with some interest in the policy making and other kind of things. So, those things are getting belied. Last year one could understand that, it was a very bad pandemic year in 2021. So 2022, it's a kind of a consolidation kind of a year. But this year, probably, even while the election is due, the Lok Sabha election is due next year. So the idea was that something grand will come. But then apart from being grand, what actually we have seen that other panelists also mentioned that the economic survey says that central and state governments budgeted expenditure on the health sector, it is 2.1% in budget estimate of FY23, which means 22-23, and then 2.2% in FY22 revised estimate against 1.6% in FY21. However, in the current budget, the last budget of this tenure of the budgeted expenditure actually stood at around 1.98%. But anyway, I'm not getting into that. I don't want to take too much of time on that. But the point is that if we, I think Dr. Chandrakant Laharia, in fact, made an estimate, I think, which is absolutely correct, what Dr. Jha was also talking about. If this increase, this nominal increase is adjusted for GDP growth, inflation, and population growth also in the same period, the allocation of the health sector will be effectively been reduced by around 6%. So actually it has contracted by 6%. That is what Dr. Laharia is saying. And I think he's correct. I think he's in the right direction. Now, I don't want to, talk about it, but the point is that our kind of, and, we ourselves, we said that in National Health Policy in 2017, that we put a target of raising public health expenditure to 2.5% of the GDP by 2025. But even then, it will be it will be just a little bit more than Nepal, Bangladesh, and Pakistan, countries like that. And then if you are trying to become one of the frontline countries in the world, then UK, New Zealand, Finland, Netherlands, Australia, they all have over 9% of their GDP kind of expenditure. So lag is huge. I'm not even talking about the countries like Japan, Canada, Switzerland, France, Germany, even US spends 16%, I think, last when I checked, of GDP or something like. So as the panic and fear of public backlash of the pandemic disappeared for the time being, the discussion on long-term agenda of building public health actually has vanished. So current budget health allocations are only a reflection of that. Very quickly, if I may, with the the permission of the chair, if you can give me a couple of minutes, I'll just also talk about, because you have only mentioned in the beginning itself, because that is also, I think, one of the major problems here, because the population, we are the second most populous country after China. So, we cover 2.4% of the global surface area, but 18% of the world's population. A 2019 UN survey population estimates actually projected that India would surpass China in 2030 and will maintain the first rank after that. And it would peak at somewhere around 1.65 billion in 2061, and then it will decline thereafter and probably will reach 1.44 billion by 2100 or something like that. But within our this thing also, there are problems, because within the, if we look at the spatial distribution of Indian population across states, then there are certain problems, because problems is that the 4 large states of Uttar Pradesh, Bihar, Madhya Pradesh, Rajasthan, they accounted for 37%. They continue to exhibit above replacement fertility rate, which is the 2.1 children per woman. So, that thing is there, and higher mortality levels. Why it is important? Because higher mortality levels means then more health expenditure will result into less number of deaths in these areas. So obviously the population will increase in these states. Whereas, there are states like Kerala also, where actually it may turn negative around 2036. Andhra Pradesh is estimated, along with the new Telangana, around 2041, it will turn negative. Karnataka and Tamil Nadu around 2046, it will turn negative. So that means that these 4 states will hold almost 45% of the national total, population. This has got serious health implication, apart from all the, socio-economic and political fallouts. So one, at least I expected, some kind of, some kind of broader kind of thinking about in these lines. This population dynamics is very, very sensitive. I would say that it is very, the changing population dynamics, it will directly impact the future of health infrastructure and allocation. And of course, the point you made, I want to reiterate it also, that the elderly population, 6.8% in 1991, 2016, 9.2%, projected to go 14.9, which means 15% in 2036. And during this period, the youth in the age group of 15 to 29, which is now 27.2%, will go down to 22.7%. So I think you are absolutely bang on, right? Bang on target on your point that we are gradually entering the phase where more people will start aging. Here, actually, I was planning to, link it up with the out-of-pocket expenditure, because if we don't get into the debate of whether insurance-based, health insurance-based Medicare or Mediclaim is a very good model or not, I'm not getting into that. But the point is that we don't get hospitalized. If I get hospitalized for 24 hours, only then I can claim. So if I cannot claim that, so my out-of-pocket expenditure, which actually in the past have gone down, but it has not gone down sufficiently. As I said, it is almost 55% in 2019. I think situation has worsened. Situation has not become better, definitely. So, these are the points where actually, the intersection of population and health, where in fact this was a budget probably could have looked into, and it had actually the, I would say the broader context, the electoral context of 2024. 2024, but I think it has actually missed the bus. And I'll stop here, and then the broader macro questions, probably, if there are some questions in the question answer session, then probably I will try.
Thank you very much, Abhijit. I will start with some questions, and maybe other will have the participants will also have questions, and I'll start with Professor Acharya. Professor Acharya, you mentioned one program, very good program, sickle cell anemia.
Yes.
I was also reading about that. The problem with these kind of programs are announcement, it looks very good, but there are 2 things which are concerning regarding such announcements. One is we don't have a very good blueprint how we are going to do that, and we generally miss the deadlines, like whether it's related to Kala Azar, whether it's tuberculosis targets. So we miss on those. And in this budget also, though it has been mentioned and everybody's hailing this, that this is a good program, but there is no budget head for this.
Yes.
And there is no allocation given for this program. So I'm thinking that it will be from the overall National Health Mission budget that they will have to carve out the allocation for this program, because if it is announced, so maybe it will get highlighted.
Yes.
And maybe some other program will get further squeezed out because of this. Because within National Health Mission, how many schemes or programs are there, you will have to manage on that. So shouldn't there have been some clear, like how they are going to do, and from where the budget is going to come, or whether it will be from the existing National Health Mission budget, or that would have been like when ministry might have been consulted because of, before making this, and ministry should have asked for additional budget for this. So that's my, like, this, you can say overall that schemes are announced, but they are not followed with a proper budget allocation or implementation model. And then we lagged, like, okay, announcement was made, we became happy, but then we keep on shifting the targets, the deadlines. So that is one my question to you, like, what do you think on that? And if there are other schemes, like as you mentioned, that there is a fuzziness around these nursing colleges also, whether those that will be new colleges or whether it will be the old refurbished colleges. And my question in that regarding is also, and what Abhijit was pointing at in the end, who will be these nurses? Like these nursing, the courses will be the, like, mostly helping with the routine health services, or they will be for taking care of the increasing elderly population, whether the training modules will be in such a way that the tertiary care or non-communicable disease or lifestyle diseases, whether these nurses will be able to take care of the elderly population, which is increasing, which is again like 70% or more than 70% living in rural areas. This is my one question. And the second question is, you mentioned that in the health research also, as well as the collaboration between public and private labs, and this center of excellence, where they will be located. My reading of the budget is that they will be located in private pharmaceutical labs. The whole innovation and the thing is development innovation is under when they are discussing about the pharmaceutical and the private labs. So the overall response which took place in the case of onslaught of COVID-19, it was burnt by mostly the public health sector. Private sector was missing. And now we are not taking that learning from that, the lesson from that, and strengthen our public health system, response system, preparedness, emergency prepared, as well as response system. Rather, we are again going back to the private sector, which was almost missing during when they were most required. So, your thought on these two issues.
Professor Singh.
Thank you so much.
And yeah, Professor Jha also, like, you have to
leave. Yeah, I have to leave in about 5 minutes. That is the outer limit for me because of another engagement. So if you just give me half a minute, I just want to.
I had another question also, like related to the second one. Overall, the government is more of privatizing the public health institution system or units. Do you see with the health realm also the same approach is being taken by the government? If you can start, and then if we are very thankful if you have to go.
Yes.
And
Professor
Acharya can take over.
Yes, Professor Sanghmitra Acharya can take up these issues with a much more substantive kind of orientation than I can. So I'll just make a couple of very brief remarks. See, on this whole question of push towards privatization, that has been very clear for a long time. The public sector, unfortunately, has tended to take very little responsibility, and even things like PHCs, etc. Abhijit was talking about it and how they have been kind of starved. I remember my childhood, some sort of 50 odd years ago, there was a good functioning PHC in my village. Yes. It doesn't exist anymore, right? Whenever I go there and so on. So yes, in general, there has been a push towards privatization, push towards not being able to take care of the expenditure which government should be making, etc., in a substantive manner. Bits and pieces here and there. So that has been the approach. I mean, Sanghmitra can probably talk a lot more about it. Let me just give you a very simple figure. If you look at union budgets, sort of, and what is their share in overall, the spending on health has a share of GDP, right? Let's look at from UPA 2 onwards. It used to be around 0.3% of GDP, 0.3. Much of the expenditure is done by states, right? It increases during 2021 and 2022 marginally to 0.4%. This is the peak of the COVID context. We are back to 0.3%, right? Now that tells you something very profound. Yeah. Second, there is no real work in connecting expenditures with the requisite unit costs. We have to think in terms of benchmarks. What would be appropriate? If you spend just 2 rupees, is that good enough? Or is it simply a waste of resources? There has to be a conception of critical minimum unit costs, right? PHCs, different levels and so on. That has been a bane in terms of our thinking, etc., with respect to health, education, and so on and so forth. 3, there are these questions of intersectionalities when we talk of health as an issue. It's not simply setting up hospitals and giving medicines and so on and so forth. This interconnectedness, and that's why I had flagged this question of what is happening to MDM, what is happening to ICDS, what is happening to nutrition, what is happening to sanitation, and so on. How do we combine all these in our discourse and conversation on health? And finally, growth is desirable, but growth fundamentalism is terrible. You can have a growth rate of 7%, 8% and zero labor absorption. Yeah. This is exactly what we have seen during the last 4 decades or so. Everybody by late 1980s was talking of jobless growth. Yes. What we saw in India 2014, 15, 16, 17 was job loss growth. And this is pre-pandemic. Pandemic played havoc in terms of job losses, etc. So, I think it's extremely important when we sort of talk about rates of growth to think of structures of growth. When we think of capital expenditure, we have to think of structures of capital expenditure and so on. Otherwise, it's not a very helpful conversation. Yeah. So with that, my apologies to you, to all other participants, because of this other commitment. I have to leave now, and thank you, everyone. It's been a very important conversation, very helpful conversation. So thank you, sir.
Thank you very much, sir.
Permission, then I will leave now.
Yeah, bye.
Thank you very much.
Thank you. Okay.
So, Professor Acharya, we can continue the two issues which I flagged.
Thank you. Thank you so much, Prof. Singh, for flagging those 2 issues. I think it's extremely important to get on board with the 2 issues that you've already kind of said, and with which I started the conversation in some sense. I would really perhaps bring that in the light of when we are talking about infrastructure, when we are talking about provisioning of facilities alongside the care providers, I think training of the public health cadre, nursing is one of them, becomes very, very important. But like, as you said, another important element that the budget is informing us about or taking on board is the interdisciplinary training of these personnel. Now, when we say interdisciplinary training, a lot has also been pegged, we've seen already in last few years, institutions and training which is being provided for health administration and a lot of other activities, training, skilling, etc., which is happening along health administration. therefore, to my mind, when it is intersected in terms of interdisciplinarity, I will probably say that we'll need to wait for the roadmap, which needs to be to tell us about this interdisciplinarity in training the public health cadre. Because when we say public health cadre, it becomes a fairly large universe. You've already said pharmaceutical industry coming into in a big way when it comes to research. So when we're talking about public health cadre with the aging population right there, it doesn't really seem to inform us about how much of administration will get into this training, how much of care for different population groups will come in, what will be the share of population which is aged, and therefore it does not really inform us about that. Also, in terms of the unit, which I think a couple of us have already pointed out, these new centers which are being pegged, what is the nature of training that it will bring on board? That is one. The other is nursing as a profession is something where we have already been seeing, if I can draw back on the term brain drain. In fact, we are the second largest exporters of nursing professionals as even today. Philippines is the first one. So in all of that, who will be there? Where will they be absorbed? Given the conditions that we already have certain a large share of positions remain vacant. So what will be that contention? We really would want to, we'll have to wait for that. The other point perhaps that you were kind of putting on was in terms of what is the collaborative nature, what is the research that we are interested in vis-a-vis what the budget is kind of directing us towards. And I don't think we need to shy away from the fact that there is a tilt towards privatization of research also, because as of now, there are universities, there are research institutions where research of this kind, which feeds into healthcare provisioning, which feeds into health in general, which feeds into public health, is in place. So when we say in the budget, Center for Excellence, what will be those criteria for identifying the Center for Excellence? I'm sure there must be something in place already, but as of now, it doesn't really tell us. And that's where perhaps we will all perhaps want to believe, and also because there are directions towards it that they'll be largely located in the pharmaceutical industries or institutions which are tilted towards private orientations. We already have government's own NITI Aayog volume Reimagining Health telling us that when we are talking in terms of public-private partnership, the private institutions will be using the infrastructure which is in the public sector, but when it comes to profit sharing, the discretion will completely remain with the private sector. So I think this also is kind of informing us something towards that. And therefore, to my mind, when we reflect again in terms of the first point which you made in terms of the sickle cell anemia, sorry, I'm taking just about 30 more seconds. Given the fact that when we look at the rural health statistics, and if I go by what is available, I think 21-22 data, we still have, if we go by the tribal areas, we are still in deficit vis-a-vis the primary health centers. I think at that time point, as the data for 31st March 21 suggests, we are less than 4,000 PHCs which are in the tribal areas. And sickle cell anemia, like I said, will require these PHCs, will require institutions which are at the grassroots levels. And therefore, I think it becomes very important to see how is the infrastructure being renovated, or is the pegging does it remain only at the tertiary level care, or does it percolate down to the primary level also? A lot of, even under NHM, we see the contractualized workforce that is becoming more relevant. The human resource and health is a larger share is getting contractualized. Are we going to take that on board in this context? And therefore, one little point that I really want to quickly come to is where I think the question which Dr. Mukhopadhyay has already talked about. One small point I want to talk in terms of when we get into that understanding that out-of-pocket expenditure did reduce, and that reduction is largely attributed to the fact that public sector institutions were used or public sector care was being used, and that probably is the possibility of bringing it down. But I'm sure post-COVID the figures have increased also, because it can't be possible that despite the the care services in all their forms, in terms of consultation, in terms of medicines increasing, out-of-pocket expenditure will go down. Because if the public sector use has increased, it doesn't really get corroborated with the data, utilization data. If at all, it would have increased. A lot of tertiary care still remains in the private sector, and therefore it's a bit of a problem to be able to see that the overall change, the whole sector has kind of reflected it in this sense. Because I think there are studies which are telling us that out-of-pocket health expenditure has put a good share of our population anywhere in the world, for that matter, below the, has brought them back into poverty. You've reverted to the levels of poverty. There are studies which are suggesting if we are in a position to, if the out-of-pocket expenditure can be kind of as a share of total expenditure, if it can be reduced, we do see that what we are at the moment at the level of 3% of the GDP. I don't think the out-of-pocket expenditure will be able to be reduced if we don't address that element of enhancing the share that we have it. So I think to be able to get there to the reduced volume in its worth, perhaps I think we'll have to make sure which sector is it that is being reflected in terms of this reduction that we are talking about. Post-COVID, I'm not too sure. I haven't had a chance to look at the data post-COVID. The data perhaps I've had a chance to look at is still 18, 19 kind of a data set. So that's where I thought, let me just bring it. Sorry, I've taken a little more time than you probably gave me. Thank you.
No, thank you very much. This is the discussion time. And so, and Professor Panda, on the same issues, budget, you mentioned, especially the PMJY budget. I brought in the sickle cell anemia. So they're like not taking very clear position where the budget is coming from, whether it's an increment or also, like I was reading a report, an analysis of this PMJY also, that this was such a big program of the government and especially the Prime Minister. Still, the allocation is more or less the same. But I was also reading that you mentioned that there is a slight increment, but in it, I was also reading like people.
Ayushman Bharat has reduced. Ayushman Bharat slightly, marginally got.
Yeah, I was reading that it has
in
gone
absolute
down.
Absolute numbers,
yeah. So, and you also mentioned that primary health center, the push which you were expecting has not come. So, where do you see the priorities of this government as reflected in this budget? Whether they are in the right direction, or you would like something different in the budget and the priorities of the government?
Yeah, okay. Let me first clarify a little bit about the budget allocation for PMJ. So there has been an increase, but it is in nominal term. For example, if you see the financial year 23 and financial year 24, so there is an increase of 12% from 6,412 crore to 7,200 crore. Of course, if you account for inflation and GDP growth, etc., maybe this increase is not much. Either it may decline or remain constant at the previous level. Now, okay, that is a difficult question. As I actually stated in the beginning of my talk, actually, it is a challenging time for the government. So basically, this budget is about fiscal consolidation, how to reduce the fiscal deficit. So to that extent, we should give credit to the government about reducing the fiscal deficit from 6.4% or something earlier to 5.9% now. And they have a target next 2 years to reduce it to less than 4.5% as the finance minister. So the fact that it is a budget about fiscal consolidation, they have focused more on the infrastructure side. And as you see, very from the beginning, education and health are of low priority. It is not a new thing as compared to other sectors historically. And this started during Nehru time, the Nehru model of industrialization. That time there should have been more focus on education and health. That did not happen. That time we started big industrialization, more IITs, more IIM. We want more engineers. Rourkela steel plant, as you know. So the focus on education and health has been derailed. Now actually it is too late. And another thing also, we have to look at the political economy. For example, we have the voters. In spite of, do you think if the current government will allocate more resources on education and health, they can win the election? Do people need them? That is a key question. We know our voters. So this is a problem with the political economy question and democracy. Whereas if you give freebies, they are very free rice everywhere in all states and everywhere. Free rice, free wheat, etc. All freebies. People are very happy. So historically, it has been a low priority. So given the current budget, which aim to consolidate the fiscal position, it has less room, as one could see, to increase allocation for education and health. And again, it is an election year, as you know. So they have to satisfy the voters as well. But at the same time, there is no drastic cut in the expenditure for education as well as health. So if you see the last 2 years, so it accounts for 0.3% of the GDP, the central government allocation for health. If you look at education, it is 0.4% last year as well as this year, slightly more than health. So at least there is not much reduction. So given the current fiscal situation of fiscal consolidation, there was not much room probably for the government to. So what the government has done within the low level of resources allocated to the health sector, what it can do, better. So then they have reallocated, given their plan. So therefore, as I read out, there are some schemes, there is a huge or considerable increase in the expenditure. And it is based on what the government has proposed. For example, 130% increase for the Pradhan Mantri Ayushman Bharat Health Infrastructure Mission. Of course, it is in nominal term, but even if you take real, still the increase will be substantial. Okay. Similarly, 146% increase for National Digital Health Mission because of the focus of the government on artificial intelligence and etc. etc. Okay, 59% increase. This is a good thing which has happened. 59% increase for RCH, reproductive in child health and health system strengthening, National Health Program and NUHM. In nominal term, there is a 59% increase. So I believe the question you are asking that some of the how government will maneuver and look at the various line items in the budget and see from which head to invest for for the sickle cell project, or for that matter, investment in the nursing colleges, because there is an increase in the infrastructure fund. Probably because of an increase in the infrastructure fund, some money will go to building infrastructure like nursing colleges. Similarly, sickle cell anemia. So there is an increase in the three, that is flexible pool for RCH, National NHP, National Health Program, and NUHL. Probably some money from this head will go for sickle cell. So because they have not spelled out, difficult to know. But it is a political economic question. Still, they could have done little better. And this budget allocation should be based on the evidence. And we know from various data sources, we talked about, non-communicable diseases. Then there is an increasing in the elderly population. They need geriatric care. We have very little so far, which you had talked about in the beginning. So that is my overall assessment. Thank you.
Thank you very much. Abhijit, would you like to expand further on the last topic which you were speaking on, like how the population structure is changing and how the budget and health is going to be affected? Because not only its demographic phases, India can be divided into 3 phases. Even epidemiological phases, the publication which was brought in by Public Health Foundation of India. So it has like four stages. It put different states in 4 stages, and the 4 states you mentioned, they are in like first stage of epidemiological phase stages as well as demographic stages, where even still the communicable diseases are significant in these 4 stages. You mentioned mortality, like rates will be high, the population will be increasing because fertility is still high. So you want to expand further on that, like in how it's going to have impact in terms of health or economics, and what can be done, or what you would have liked to see in the budget or in the policy making of the country?
Yeah. Basically, I hurried through that last part, but before, getting into that question, what Professor Panda was saying about Ayushman Bharat actually is right. I just checked. I just checked in the scheme thing that in nominal terms, in absolute terms, the allocation is, but what will happen in the revised estimate and in the actuals, we don't know. But in nominal terms, it has increased. It has definitely increased. Second thing, before I start, addressing your question, or rather the issue, not the question, but the issue. But this Professor Panda kept on saying that that entire Nehruvian model and other things. I have I have a little bit of problem with that. The problem is that Nehru and Modi are not comparable. In spite of all the WhatsApp forwards we are getting bombarded from morning till the night, at the dead end of the night. But number one point is that. And secondly, health and education should be the priority. The social sector should be the priority every time. It should be always the priorities, because otherwise you cannot grow also. Why I am saying so? Because I am not taking any kind of moral or a very humanistic kind of position that why should some people will be left out. I am not saying that. Even from pure economic point of view, that point is that suppose we assume that India keeps on growing at 5.5, 6.5 kind of growth rate, which is difficult. That's a separate issue altogether. That is not related to today's topic. But then if we assume for a minute that India is doing that, but then the general population of India will not be able to get some benefit out of that growth, unless and until that population is nurtured by proper health and proper education. Then obviously they will not get any income. So all kinds of incomes will then will start going out of the country, which in any case, happens at the production level. So, so that is the main idea. There are other points also. I'm not getting into that. But coming back to the point you are trying to make is that probably I'm not the expert in talking, but what I felt, while going through all these data, what I felt is that everybody is talking about that, that entire demographic dividend. But, Professor Jha was talking as if that, that is a demographic disaster. I would rather say that we are into the path where this demographic dividend can become a demographic curse, for our country. Because we are already, because that is why I said that I read your article also, because you wrote a detailed article. Whether you had another academic article or not, I don't know. I read that newspaper article, which was pretty detailed, and from that, what I gathered, even later, in fact, I corroborated it with other kind of supplementary findings also. Probably we don't know, because these are all estimates, and we never know. The census did not happen for whatever maybe the reason. We are not getting into that, but the point is that 2021 census didn't happen, so we don't know what is happening in that entire demographic dynamics. So obviously the point is that maybe we are already into that phase, that where actually the aging population will very gradually but surely will start taking the place of the young population. So that is one part of that demographic curves. Now the second part, what I could not, hurriedly, I tried to finish it off because I took a lot of time. In fact, most probably, I took more than 5-6 minutes, of the stipulated time earlier. But what I was trying to say, that nobody talks about the aging population, and 2036 is not that, that far off a time, because, it is only 13 years from now. And you and I will be into that bracket also, by that time, we will be 60 plus. So obviously, that 15% of the population is not a matter of joke, and nobody is talking about them. This demography, how do they survive? There, in fact, comes the entire question of out-of-pocket health expenditure, because insurance also has its own problem. I'm not getting into that, at least for the time being. But my point is that unless and until I am a 65, 66, or even 70 years old, person, and I didn't go to the hospital, I didn't got myself admitted into the hospital, but I had to have some kind of a treatment. Then how do I spend money? And if this thing, we made some gains. The point I was trying to make was that probably, I could not finish it properly. The point I was trying to, that there was some gain, then when government was putting in some money historically in the last probably 10 years, 8 to 10 years or something like that, or maybe even beyond that, probably in the last 15 years or so, then there was slow but a gradual decline in the out-of-pocket health expenditure at some point of time. But if we are not once again be attentive to that, then possibly it will go off. It will affect the entire population. There is no doubt about it, but it will affect more this 60 plus, this entire aging population will be in a kind of a survival kind of a difficult kind of stage. And once again, the point Professor Panda was trying to make, if I may, once again incorporate that thing here also, because even this population is not insignificant, because these are the population which will create your consumption demand in your economy, and consumption demand is the primary driver of, apart from the export demand. Export demand is second. Consumption demand is the first. So obviously, when you are into what in the so-called business cycle, you are on the lower side of the business cycle, investment demand is down. The kind of situation right now we are in, where export demand is actually going down. So where do you rely on? You rely on consumption demand. And if your 10%, 12%, 15% of your population are not able to, spend money properly on different kind of consumption goods or industrial goods, then where do you, sell your things? Then obviously, that is the basic idea which I was trying to make.
Yeah. If you allow me briefly, can I make a point?
Absolutely, sir.
Briefly, just one point is that you might have gone through the recent book by Ashok Modi. And what the book talks about is that two factors are fundamental for the economic growth of majority of the countries. The first one, education, and the second one, female labor force participation. So we are a big country with huge amount of allocation of resources, but we have low priorities in these two: female labor force participation and allocation on education. So that is one point I wanted to make. Second one is out-of-pocket expenditure. If you look at the NSSO data as well as the National Family Health Survey data, of course, NFHS collected data on out-of-pocket expenditure only on delivery care, not for other issues. So many of the states, the out-of-pocket expenditure is much higher in public health facilities, including Odisha. So I am doing a study now for the government of Odisha, because government of Odisha is concerned. They have Niramaya scheme. They provide free medicine. They have also Biju Swasthya Kalyan Yojana, BSKY. They give free medicine. So government is worried. We are giving everything free, and how come the out-of-pocket expenditure in public health facilities, in primary health center, community health center, district hospital or subdivisional hospital, it is higher. So we are looking at the issue related to, and most of the expenditure is due to medicine. So we are looking at the issue of supply chain management. There may be a problem how the medicines are actually being procured and distributed, starting from the state level, OSMCL, for example, to the district warehouse, from district warehouse to the community health center, and to primary health center. Also, we are looking at another aspect, is prescription audit for rational use of drugs. So we are looking at the prescriptions and saying, well, are they recommending branded drug or generic drug? Are they recommending too much of antibiotics and other type of issues? So thank you.
Processing, can I just take half a minute?
Yes, I was going to ask you only, like,
Okay.
if you have any last minute.
Yeah, very quickly,
Yeah.
I think I just wanted to perhaps reflect on the so much emphasized demographic dividend. I think we are in that phase where the workforce can actually be maneuvered, but then the roadmap for that maneuvering is still like not taking its shape. Otherwise, we wouldn't have these 5 lakh odd, youngsters going out to study, etc., people giving up their citizenships. And I say this very consciously for the simple reason, and I'm connecting it with what Professor Panda said, and perhaps Professor Mukhopadhyay said, Nehruvian era may have tilted towards industrialization, but we see almost all institutions of higher education coming up during that period. We are reaping the benefit of those institutions of higher education even today. That was one point I wanted to make. And in the light of this, if I may say, the income tax levels, the first slab having reduced. Now, I'm seeing that in connect with what we are saying, reaping the demographic dividend vis-a-vis this segment of population, which is the new earner, if I may use that phrase. Now, this new earner is very, very aspirational, who is also trying to own a car, own a housing, etc., etc. So this is that segment of population which is also living on the EMIs, for example. No, I have, so over and above that EMI, now probably I'm also coming into the bracket wherein I have to pay in my income tax also. So, and on the one hand, this is the brunt that I must be bearing post-COVID. We know how COVID, what I think Professor Praveen said, job less to job lost kind of a scenario. So I think we do need to consider all of this when we are pegging so much on what is it that we are creating for this to reap the demographic dividend. And therefore, with the concessions for the senior citizens being done away, I'm again a little skeptical. What segment of senior citizen how will this segment of senior citizens will be taken care of vis-a-vis the expenditure, even if we are restricting itself for the health expenditure? If the health can be taken care in the prior years, perhaps the status of health will be better during the twilight years, and therefore I think it becomes very important. Something very interesting which I noted about the budget, and I want to flag it right here, is when we had the previous Minister of Social Justice and Empowerment, he probably in one of his statements said that no sewer deaths haven't occurred due to sewer or septic tank activities. But this budget has taken cognizance of the cleaners and the cleaning occupation. So I was quite enamored, in fact, to see this being reflected in this budget. So I don't know how a roadmap again is missing, but the fact that it has been mentioned, and I see this in the light of perhaps not only Swachh Bharat mission, but also the larger connect to cleaning, keeping the environment clean for health and well-being. I mean, we can go and talk about health versus clinical care that is being provided, because we're talking of well-being through yoga, through a whole lot of other sense of being well. And that's why I think the realms of mental health, etc., have been taken on board. Just wanted to bring that in. Thank you.
Thank you very much. And we had a lively discussion. Just to summarize, the budget is an important occasion where we look at what we had planned, how much we were able to achieve, how much we were able to spend, and based on our experience as well as the requirements, demands by different sectors and ministries, we also allocate money for the coming years. So we were discussing this year's budget in the context of population changes which are taking place and the health requirements of Indian people. And the overall impression I'm getting that there are certainly some good initiative in the budget. From the health equity point of view, we can say how the sickle cell anemia, especially which is prevalent in the tribal population, that has been flagged as a high priority in the budget. Then the push which has been given to the digitalization and artificial intelligence and telemedicine, and what Professor Acharya said, that how it could be a game changer in the mental health issues where stigma is also very high. As Professor Panda also said, that there has been an increment in the budget allocation in various schemes. So those are, and especially the 157 colleges for the nursing program. That's also again a very good initiative. We need, and we realize during the COVID pandemic also, that healthcare infrastructure as well as the cadre, we are deficit in that, and it will address to a certain extent. We also discussed that we could have done more. The push for the public health sector, primary health unit, that could have been better. Primary health centers, CHCs, especially in the rural areas, how deficit they are in terms of infrastructure as well as the workforce. So that could have been given more push. Professor Acharya cautioned us that digitalization is very good, but we need to be mindful of digital divide and how we can address that. Overall, the panel was also looked at the health budget with concern that despite reminders that despite it being mentioned in National Health Policy 2017, we are stuck at a very low expenditure on the health sector, and with that kind of expenditure, it is difficult to have a healthy population in a healthy country, which has a ramification for our economic productivity, or being a happy and healthy country overall. So we need to aspire, and we need to keep pushing that we spend more on health, and health becomes a center stage, or takes a center stage of India's policies and programs and priorities, especially when we aspire to be, as Abhijit said, the frontline country in the world. So we need to spend more, pay more attention to the health of our people, and it's, like Professor Panda said, it needs to be evidence-based. Like we need to look at what are the population situation, what are the requirements, and where seeing the differential demographic situation in the country, what kind of programs we need to have for these poor states with high fertility, high mortality, and what kind of program we need to have for Kerala, Tamil Nadu, which are having low fertility and high aging population. So that differential kind of program and planning, we need to be mindful of our population dynamics when we design programs, when we allocate funds for different regions, different states, as well as different population groups. I think it was a very fruitful discussion. I certainly learned a lot, and thank you very much all. I hand over it to Nena to formally thank our panelists.
Thank you, sir. As we have come to the end of discussion today, I, Nena Agarwal, researcher at IMPRI, Impact and Policy Research Institute, would like to propose the formal vote of thanks on behalf of IMPRI, Center for Human Dignity and Development, CHDD, for today's deliberation, a panel discussion on population, health, and union budget 2023-24. We are grateful to our chair and moderator, Dr. Devender Singh, and of course to our panelists, Ms. Urvashi Prasad, Professor Sanghmitra Sheel Acharya, Professor Pradeep K. Panda, Professor Praveen Jha, Mr. Abhijit Mukhopadhyay, for taking part and enlightening us. We thank all of our participants who have raised pertinent questions and actively participated in today's deliberation. You may also find more discussion in our IMPRI Web Policy Talk series, The State of Population and Development, #Population and Development, and other thematic series. We are grateful if you are watching us later on our YouTube channel or listening to us on our various podcasts or reading our publications. We hope you continue to join in to our future IMPRI Web Policy Talk. We also invite you to IMPRI's third annual series of thematic deliberation and analysis of Union Budget, financial year 2023-24, being organized from February 2nd to 7th, 2023. Wishing you a very good evening and thank you.
Thank you.
Thank you, everyone.
Thank you.
Yeah.